Optimal ultrasound scan ergonomics for healthcare providers. Legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only. Content is not intended to substitute for professional, legal, or clinical advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your local, unique situation. The course objectives. At the end of this session, participants will be able to understand how to optimally sit, stand, utilize ergonomics for ultrasound procedures so that we can have healthcare practitioners being able to work in the healthcare system for a long period of time. There's a lot of repetitive motions that happen with ultrasound and little subtle positions of how you're sitting, how your back is, how your hand is, how the machine is, how the patient is, has a huge impact on our arthritis, carpal tunnel, our back injuries with ultrasound ergonomics. They will be able to verbalize the common mistakes to avoid with ultrasound ergonomics. The participants will also be able to verbalize the key different things to consider when implementing ultrasound ergonomics. This topic is really, really important. I can't stress it enough. Like, even though we're doing point of care, we're not doing it nearly as much as a sonographer is doing. Ergonomics of how we sit when we're talking to a patient while we're implementing a speculum, we're implementing a transvaginal ultrasound, we're standing towards the machine, we're leaning over things, we're bending, we're twisting, has a huge impact on the workforce within healthcare industry, particularly for sonographers. The disorders can range between a high workload, poor equipment design, improper posture, not the right exam table, not the right height, not the right layout of a room. To follow the best ergonomic practices and reduce those injuries with the hands, the wrist, the neck, the shoulder, we are going to talk about some of these simple things that sonographers and healthcare practitioners can. You want to be able to look consistently at your body posture and your position. Are you leaning? Are you twisting? Are your knees straight? Is your hip straight? Is your back? It not only benefits you, but it also benefits the patients and the satisfaction and the outcomes. If you're leaning and twisting and you're feeling uncomfortable, the patient's going to be uncomfortable. You want to be able to understand in all aspects of health and safety for you and accuracy of being able to view the screen well, to be able to see things completely, to be able to get the right angle with a probe. You need to be able to foster a positive work. The benefits of ergonomics, it reduces the musculoskeletal disorders. Ergonomics is crucial with minimizing for sonographers and healthcare practitioners. So they're not having back injuries, they're not having wrist problems, they're not having poor image reviews because of that lack for the area they need to see. The enhanced comfort, the improved flow of the procedure. They can get it done faster because they can see things, they can move their hands easily, they're not getting as uncomfortable. Your accuracy of what you're seeing, the position of the patient, they're comfortable, they're not leaning and twisting, and the too little gel, too much gel, the probe is sliding. You're not getting a pelvic ultrasound appropriate because you're not using stirrups and the correct table. There's a lot of things to consider with preventing long-term health issues for the sonographers and the healthcare practitioners, particularly with back pain, neck strain, and carpal tunnel syndrome. So we need to be able to sit and take care of patients long-term, sitting on a stool, standing up between the legs next to the patient. We're holding the probe with our left hand, our right hand. How are we holding it? What's the angle? How are we moving our hand? Are we moving our elbow versus our wrist? These are little things that we need to get good habits in place while we're learning ultrasound and we're improving, because it will have a huge impact. You think of the thousands and thousands of point-of-care ultrasounds you're going to do over the longevity of your healthcare. Common mistakes. This has to do with the grip, the workstation setup, the position of the physician, the healthcare practitioner, the patient not being in the best position, not being able to visualize on the screen very well because it's too small, it's angled wrong, the station tray isn't high enough, it's too low. there's a lot of increased injuries to your arms, your hands, your wrists due to improper ergonomics. We need to be able to get transducer education of how to hold it, how to move with it. You're not twisting your wrist, you're moving your arm, you're sliding, you're not twisting all the time, especially with transvaginal ultrasounds. Where are you standing? Where are you sitting? How are you visualizing everything to be able to improve your life? The key ergonomic principles to consider, you have to look at the safety and comfort of the healthcare professional just as much as the patient we're taking care of. Is the machine easy for you to hit the buttons and scroll and freeze things and view the screen versus you're leaning over the patient? I know a lot of times with OB, we really try to make it so the screen is seen by the patient and by the clinician, but the highest priority is the clinician being able to see. They can take screenshots, they can take pictures, they can talk after the fact to the patient about the findings that they're doing. Their highest priority is not to entertain them with a 3D, a fun picture service for their baby. Yes, they can see the heartbeat, they can see the gender, they can see the fingers and toes, but your highest priority is, why are you doing this ultrasound? What information are you trying to gather? And so you can decrease your exposure time and your use of your hands and your back and your body. The proper equipment, comfortable seating, the right height of everything, where's the machine positioned, how are you holding things, taking breaks often, the proper training, education, getting feedback, getting a quality competency of someone actually watching. You're slouching, you're twisting. You may not be feeling it, but your body is going to be feeling it over time. You want an outside perspective of, what about the patient? How did they feel like the flow? They're like, oh my gosh, you were leaning over me the whole time. Your elbow was into my knee while you were leaning over the machine to take care of that transvaginal ultrasound. So those important feedbacks are really, really required. Make sure that we're using optimal ergonomics when it has to do with healthcare practitioners implement these services, because the more we implement machines and tools and computers, we're going to have more and more problems with backs, necks, wrist, elbow injuries because of the repetitive use of the probes and the positioning and the layout of the room. So I want each and every one of you to be very, very conscious when you're starting to implement it. Think about how you're standing. How are you feeling? Is there aches? Is the screen need to be higher because you're tall and you're standing? Are you sitting and it's too low? How can you set up the room before the patient is in there? If you're getting the machine down the hallway and rolling it in, do you have a space set up in each room that you can easily put it where it's not next to the patient's head, or it's right next to you doing that transvaginal ultrasound versus abdominally?